So a lot of patients need bone grafting, and they ask, what is a bone graft? So the simple answer for a bone graft that I give to patients is that it's simply a little powder that we get from a company. It's in a jar, and we place it in an extraction site or wherever we need to add a little bit of bone, and it serves as a scaffolding for your own cells to grow into and replace your own bone. So when the doctor comes back 4 to 6 months later, all of that bone material that we put in, the bone graft we put in, is no longer there. It's actually your own bone which has grown into that material and has replaced your own bone in there, in that region. Now there are different types of bone grafting. So there's something called socket preservation or socket grafting. That's done when you have an extraction site and you put the material, the bone graft, into that extraction site, and it replaces and regenerates the bone in the extraction site. That's probably the most common type of bone grafting that is done. Now, when you have bigger defects or more bone that's missing, then we may do something that's called guided bone regeneration, or GBR. So GBR is a more involved process, and the patients need to understand that this isn't just a simple type of socket grafting that we're doing, but we're actually trying to rebuild a lot of the bone that the patient had lost over time due to infection or missing teeth or some other reason. So guided bone regeneration is actually when we take some bone from another part of their body, usually another part of the jaw, and place it where we need to and cover it up with a membrane. And then we close up the gums, and we usually let that heal for about 6 to 9 months. Now note that that's 6 to 9 months and not just 4 months or 4 to 6 months that we use for socket preservation. So guided bone regeneration is done when we have more extensive bony defects. The procedure also takes a little bit longer. It takes about an hour and a half to 2 hours. The patient will have more swelling after this type of procedure, so that's something to warn them ahead of time, and usually a little bit more discomfort than just a simple socket grafting. The third type of bone grafting that sometimes is done is called a block graft. A block graft is similar to guided bone regeneration in that, again, there's a bigger defect that we're trying to grow bone in. And so there we actually take a block of bone. Again, it can be from the chin, it can be from the back part of their jaw where they don't really need that bone specifically. And we take it and put it where we need it and put little screws to hold it into place. And this again will allow their own cells and their own bone growth cells to grow into and regenerate that bone. Now, one of the things to tell the patients is that afterwards they need to do lots of ice. Ice is the most important factor when we're talking about swelling for the patient after guided bone regeneration or block grafting. So ice, tell them they're going to be on antibiotics for 10 days, not the typical 5 days that we do after a simple extraction or wisdom teeth, so they have to take antibiotics a little bit longer. And then they're going to be on pain medications, which is usually a combination of ibuprofen, Tylenol, as well as Vicodin or Norco or some stronger pain medication as well. We're going to see the patient about 7 days later to make sure that everything is healing well. And then we're probably going to be removing sutures for guided bone regeneration procedures about 2 weeks later, 14 days. When we do just a socket preservation, we're really not going to be removing any sutures. They're usually dissolvable sutures in those cases. And in both of these type of cases, we will be taking a CT scan anywhere from 3 to 4 months for the socket preservation to about 6 months for guided bone regeneration to assess healing of the bone and to see how much bone is actually grown into the area of where we did the bone grafting. Now, for both of these type of cases, the reason we're doing the bone grafting is for dental implants. So dental implants are usually going to be placed later on once the bone has all regenerated.